Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the next important thing is keratoplasty. What is keratoplasty? Keratoplasty is removal of dead cornea and it is replaced with a homozygous graft or homozygous graft tissue. So this keratoplasty is actually of two types, that is one penetrating keratoplasty, second it is lamellar keratoplasty. We have one which is penetrating keratoplasty, second we have lamellar keratoplasty are the two types of keratoplasty. Actually, the donor cornea in the keratoplasty, the donor cornea is obtained from the cadaveric eyes. Okay, and it should be obtained preferably within the 6 hours but can be permitted up to 12 hours. So donor cornea is obtained from cadaveric eyes and it is obtained preferably within 6 hours but it can be permitted till 12 hours. Now, keratoplasty. Keratoplasty is mainly done to improve the vision. So to improve the vision, it can be done in conditions like To improve the vision, it can be done in conditions like keratoconus, scarring, and corneal dystrophy. This improving vision, the indication is optic type, which is done to improve the vision in keratoconus, scarring, and corneal dystrophy. Tectonic type, which is mainly to preserve the corneal integrity, and this is done in desmatocele. Then we have therapeutic. In therapeutic, it is mainly done in corneal ulcer. Therapeutic conditions, this keratoplasty is mainly done in corneal ulcer to remove the infected tissue. Then for cosmetic, actually it is rarely done for cosmetic purposes. For cosmetic, it is rarely done. So these are the main important indications of keratoplasty.
thank you and thank you for watching.